So Maharashtra, a matter of concern, and cases, why just Maharashtra, all over the country have seen an increase. This at a time when vaccination has already begun. How big a matter of concern this is? We have with us two extremely important guests, Dr. Randeep Guleria, Director of the All India Institute of Medical Sciences, and Dr. Shashank Joshi, member of the COVID Task Force in Maharashtra. Dr. Guleria, I want to begin with you first. It's not just Maharashtra. Even in Delhi now we see that cases are on the rise. Vaccination, surprisingly, after seeing a massive rise, for the past 2 days have seen a dip. Now, should this be read in isolation, or is this a cause of concern already for you?
So I think it is a cause of concern because the number of cases are on the rise, and we should act right now aggressively before we have a huge number of cases, a tsunami of cases, if I put it that way, and a huge spike. And therefore, we need to act on multiple fronts, 3 or 4 fronts. First is COVID appropriate behavior. Many people feel that COVID is over and we don't need to do anything now. This is actually creating a huge problem, and therefore we need to be aggressive to see that we implement COVID appropriate behavior, whether it is wearing a mask, whether it's physical distancing, whether it's avoiding crowded places, because all of these crowded places can become super spreading events. The second is to really push the vaccination drive, especially in those areas where we're seeing increasing number of cases. Because vaccination itself will give some degree of immunity and protect people from getting the infection and thereby increasing the number of cases. And thirdly, I think we need to go back to what we were doing in the past, aggressive testing, tracking, isolating people. If we don't have that many cases, so we can, all those who are positive, we can aggressively test, track all of those close contacts of those positive cases, isolate them, make sure that they don't spread the disease and break the chain of transmission. This is the time where we need to work aggressively so that we are able to contain this rather than, having a huge number of cases and then having a panic reaction.
Correct, correct. Now, Dr. Joshi, just taking off from what Dr. Guleria mentioned, that in these cases, vaccinations must be increased, particularly in areas where we are seeing an increase. Do you think that the time is now right for Maharashtra asking for a greater dose of vaccines? Maybe not just follow this 60+ rule. Maybe you can coordinate and ask for vaccinations to be open for all. Because we've seen right from the very beginning, Maharashtra has seen an extremely, enormously high amount of cases, even now.
Sanket, I think there are 3 things in this. Number 1 is that we must vaccinate what is recommended in the eligible group as early as possible. So what we have asked is to open the vaccination 24/7 and try to finish off the current group of more than 60 and between 45 and 60 as early as possible. We need to finish this first because this is the most vulnerable to death. So I think that is the first thing. After that, probably we need to ask the second step. Secondly, we have also asked from the central to vaccinate people who are home and who can't move out to be home vaccinated with Covaxin, because that is probably safer. The third thing is we are seeing 3 Maharashtras. One is the Vidarbha and the Marathwada region, which is a cluster where probably there has been a very rapid spread of a low exposed population, and there probably the clustering is much higher, and that low exposed population is something which is a cause of worry. Potentially a new strain could be there. We need to investigate and get data from Center on Genomic Testing. As far as Mumbai MMR is concerned, we are seeing, as Dr. Guleria rightly said, a total lack of respect of COVID appropriate behavior. And I think the Me Responsible campaign which has been launched here, people need to be responsible. You can't be reckless and irresponsible, particularly in restaurants.
But Dr. Joshi, if I were to ask you, see, yes, people have to take this very seriously. You can't be lax about it. See, the virus is still out there. But do you think that lockdowns are going to really be effective? Because you speak to epidemiologists all over the globe, and they say that you can only lock down and reap its benefit once. After that, it's wishful thinking.
So we are not at all for a lockdown. We are only for micro-containment of zones. But if people are just not listening, for example, in restaurants, people are supposed to only have 50% of their capacity. There has to be mindful masking. People are just not following the rules and norms. If they don't follow rules and norms, some stringent disciplinary measures have to be followed. So what Maharashtra is doing is no lockdown. They are basically going for micro-containment strategies, which is a standard public health strategies. And we have to go back to our drawing board. We have increased our contact tracing to 1:30. We have to be more aggressive on testing, particularly with RT-PCR.
Okay.
And all those things have to go back to in order. Lockdown is certainly not a solution.
Sure. Dr. Guleria, let me come back to you. Do you think that we, I don't know, I mean, you'll be in a better position to answer this and, study the capability that we had versus the need. Could we not have vaccinated or started the vaccination process, mass vaccination process a little earlier? And now that these cases are on the rise, do you feel that it's important to move to the next phase quickly?
So I think the vaccination process has to go through what we would have done in terms of saying that we have the capacity to do it, and we've done our trial runs and we're comfortable that we can do it. Secondly, the issue is what are we aiming as far as vaccination is concerned? The first aim is to decrease our mortality, to prevent deaths. And if we need to prevent deaths, then the first thing is to vaccinate those who are in the high risk group. And those are the elderly, those above the age of 60, and those with comorbidities.
Yeah.
Once we can do that, then we move on to the next step where we want to vaccinate a larger group to prevent the spread of infection and break the chain of transmission. But to break the chain of transmission, we can also do that by COVID appropriate behavior, a lot of testing, tracking, and isolation. So we shouldn't look at this in isolation. We should look at this as a combined effort where we try and vaccinate as many as we can. And if we find that we have enough doses available, remember these are 2 doses, that we can even move to the next stage, then we can gradually start vaccinating more and more people depending upon what is available in terms of doses. But I think we need to work in parallel. That is, we look at COVID appropriate behavior, make sure there are no crowds, develop containment zones where there is a cluster developing, and make sure that it doesn't spill out to other areas. Testing, tracking has to become as aggressive as it was in the past. So at every front, there has been a little bit of a laxity, which is leading to the surge of cases. We need to nip it right now. Otherwise, it's going to really blow out of proportion, as it has happened in Brazil, as in UK and in other parts of the world.
Sure. Dr. Guleria, one more question regarding vaccines, since we are talking about vaccination. AstraZeneca vaccine, which is the same as our Covishield, there is a concern in countries like Iceland, Denmark and Norway that it could possibly be causing blood clots, right? And they have suspended this particular vaccine. What's your reaction to this, and should this be a cause of worry here in India?
So this has been done basically in the 3 countries that you mentioned, and also has been suspended in Austria, based on the fact that there have been 2 patients reported there who had clotting, and 1 death in Denmark and 1 in Austria of an individual who a few days after vaccination developed clotting and a pulmonary embolism. 1 patient is also in the hospital but recovering. The issue is there a cause and effect relationship? Is it a coincidental effect? Now, if you look at the number of people vaccinated in other countries, UK has had a huge number of people who have received AstraZeneca. There has been no red flags as far as clotting is concerned. But there is a concern which the European Medical Agency has raised because of the fact that a few days after vaccination, these, I think the number is around 22 individuals had some clotting, and they want to look at it in terms of whether it's a coincidence or there is a cause and effect. And therefore, for 2 weeks, the vaccination process has been suspended in these countries to really get more data. I think the signal, we need to investigate it, but I don't think it's a cause of concern right now, because there's been huge number of people who've been vaccinated in millions across the world and AstraZeneca has been used extensively. We haven't seen any such signals anywhere else. So it could be more of a coincidence rather than actually a cause and effect.
Okay. Dr. Joshi, very quickly, in the short and the long term, particularly the short, because these cases are rising right now, beyond what is being done, would you propose something else? Something that can be done, particularly in a state like Maharashtra?
So I think we have to do aggressive public health and micro-containment, and we have to do more contact tracing and probably institutional quarantine of asymptomatic cases. It is the asymptomatic cases, 80% of patients or cases are asymptomatic and they are not staying at home and they are being reckless. So probably in many districts in Maharashtra, we have enforced the policy for institutional quarantine.
No, but then how will you do that, Dr. Joshi? Because a prerequisite is to have an infrastructure. Are you sure that...
We have infrastructure in place and we have field hospitals still in place and most of them are unoccupied. and that is something which is being done, and that is a short-term strategy which has to be adopted, and many districts in Maharashtra have adopted it, because otherwise what happens is that we have to break the chain, and if you are not able to break the chain, that will be there. Second is 24/7 vaccination in the most vulnerable group. The good silver lining from Maharashtra is recovery is excellent, and death and the case fatality rate has come down to 0.5%, and we are reporting lower number of deaths compared to last year. So those are the two good signs.
Yeah, Dr. Guleria, I think this point that Dr. Joshi mentioned is very, very interesting and out of the box. 24/7 vaccination. Because right now we see a rigid system that is followed for good reason, because it helps in tracking each and every individual case. But do you think going forward in the future, we can look at a situation where you've got vaccination that goes on 24/7?
Yes, I think that is also being looked at, and I think, if I'm not mistaken, the government has actually approved 24/7 vaccination in the private sector where it is possible to do. In the government sector, where you have other patient care and non-COVID activities, they can't run the vaccination program till late in the evening, but may not be able to do it 24/7. But I think it's a good idea that we try and have it 24/7. But I also think we need to reach out to people who are not able to come to the vaccination center. So we may have a large number of elderly who want to get vaccinated, but for various reasons, they may not be tech savvy, they may not know how to reach the center, or they may not have that much of information. It could happen in urban areas, it could happen in rural areas. So we need to reach out to them and develop a strategy of how do we get them vaccinated.
Aggressively pushing the vaccination.
We need to really develop that. We need to develop a strategy for that also.
So you're saying aggressively pushing the vaccination program, because right now, see, the onus is on that individual to go and register and then get vaccinated. So whoever is getting vaccinated right now is a person who wants to get vaccinated.
So, if I may put it, there are people who want to get vaccinated but don't know how to go about doing it. So it's can we facilitate it more over and above the app. So suppose we have people in rural India or people who are, let's say, elderly, who are homebound and not able to come out. Can we develop a strategy that someone can go and reach out to them and help them coming to the vaccination center, or the vaccine reaches out to them, so that we can get them vaccinated. So that strategy also needs to be developed, so that we are able to reach out to more and more people.
Sure. Dr. Joshi wanted to come in very quickly. Yes, Dr. Joshi.
I agree with Dr. Guleria. We have proposed actually a home-based and a mobile van system where people can go and vaccinate the senior citizens, particularly in rural India as well as in urban India, and reach out to them also in the slum population, because some of them are not as tech savvy and they find it very cumbersome. So the most vulnerable group is taken care of, so that we don't lose lives.
Okay. Dr. Guleria as well as Dr. Joshi, thank you very much. Let's just hope that since we have been able to tackle vaccine hesitancy, a lot of people are now coming out and taking the vaccine. We should be able to present this as that Sanjeevani booty to make sure that these cases don't rise again, because a second spike is going to be disastrous. The virus is still out there, ladies and gentlemen. Thank you very much, Dr. Guleria and Dr. Joshi.